Okay. Great. We are, folks are filtering in. We'll promote staff to become panelists when their time is up, or when they're on the agenda. So we won't promote staff right away. We do have a fairly packed agenda, but I'll turn it over to you, Tejal, and the meeting is recording.
Right, so I should start with our little preamble here, correct?
Yes, please.
Okay. Chapter 107 of the Acts of 2022, known as an act relative to extending certain state of emergency accommodations, was passed by the General Court and signed into law by Acting Governor Karen Polito on July 16, 2022. That legislative action revised Section 20 of Chapter 20 of the Acts of 2021, and in so doing provided modifications to Massachusetts open meeting law, which allow for flexibility to hold remote-only and hybrid meetings while preserving public access and, where appropriate, public participation. Currently, that additional flexibility will expire on March 31st, 2025, unless additional legislative action occurs. As part of today's remote meeting, all votes will occur via roll call. All righty, well, welcome everybody, and thanks for joining us. Tim, I think we have a public comment period at the moment.
We do always invite the board to, if people want to register public comments. We got no one who registered to actually speak to the board.
Okay.
We do have a couple members of the public who are not staff members, in addition to a lot of staff members amongst the attendees. So I don't know if you want to ask any of them if they'd like to comment, or if you want to just jump in.
I think if there are members of the public that are listening in, this would be the time if there is a comment that you want to make.
No hands are up. So.
All right. Okay, so then let us proceed. We'll start with a review of the minutes. Any edits to the minutes that anyone has?
No.
No.
No changes.
Okay, motion to approve the minutes.
So moved.
Second.
Second.
All right, we'll do a roll call. Kathleen.
Yes.
Yes.
Stephen.
I need to abstain, wasn't there.
Rob.
Yes.
And I will abstain as well, as I wasn't there. Okay, perfect. Let's continue on. Let's start with our first agenda topic, which is the senior assessment.
Good morning, everyone. I'm happy to be here, and really happy to be able to report on the senior assessment, which, as you know, we conducted we started last summer. Do we have the slides? Okay, thank you. So the senior assessment was conducted, the survey and the interviews and the focus groups were conducted last summer, and we are pleased to be able to present the completed report now, which, by the way, is also an element of our community health assessment. Next slide. Or do I have the ability to do this? Okay. So this survey was, or this assessment was in a sense, a follow-up of the survey and assessment that we did 6 years ago in 2016, which is what I was originally hired to do here. The age range was changed a little bit for this survey. We began with residents who are 60 years of age and older, where the previous survey was age 55 and older. We had a really good participation rate in the survey, And a larger percentage of the survey respondents responded electronically for this survey than for the previous one. And we think that has a lot to do with one of the few positive benefits of the COVID pandemic, which was increased use and accessibility to technology. There were 4 focus groups, and we conducted 23 key informant interviews. Next. So this shows what percentage of each of the survey of the age breakdowns, the subgroups in the ages, looks like our participation rate. We can move on. And larger percentage of female participation than male. We asked different questions about gender this time and included transgender questions, and we had some respondents who identified as transgender and non-binary. I think we can move on from this one. We had some more specific questions about racial identity, and as you can see, we had a very small percentage of certainly Black and African American, a larger percentage of Asian respondents, and predominantly, of course, white respondents. We asked questions about housing and where people lived. Most people live in private residences. What we see here is that there were people in various kinds of senior housing. The Needham Housing Authority property is also really senior housing, and long-term care facility was a very small number. Here's something interesting, which is we asked about accessory dwelling units, and there were 2 participants who live in accessory dwelling units who participated in the survey. Okay, so the strengths that that participants identified, strengths in Needham, what they appreciate about living in Needham. There was a lot of praise for town services, the library center at the Heights, the meal deliveries, both from aging services, which began during the pandemic, and traveling meals. People identified that there's a great deal of commitment from staff who serve them, and really strong collaboration among the programs. Increase in technology and engagement with online programming was a positive from the pandemic. There was a lot of talk about accessibility, about being able to access services online, and as you know, that has continued post-pandemic. The challenges, some of them are consistent with 2016, housing, limited options, cost of living, food security, was a concern that was, I think, a little greater this time around. But there was also more explicit talk about feeling devalued in the town, that older folks feel like they're being pushed out by the large, expensive housing and by the changing demographic in Needham, and just feel generally underappreciated and undervalued. Transportation and driving is another consistent theme. Decreased access to healthcare, I think, was also highlighted and increased during the pandemic because of reluctance to be exposed, and also because of access, provider availability, and so on. Connections and isolation. As we know, many people experienced isolation and loss of connections during the pandemic, and that was true for the older folks as well. The people who do not use communication technology still find it very challenging, and even those who were using it found accessing particularly Zoom meetings difficult. And this is a theme that we've heard from a couple of folks. It was not a question on the survey, but rather something that came up in the focus groups, and also in written free text in the survey, was a feeling that the programs at the Center at the Heights are geared primarily towards older seniors and not so much for the folks at the younger age, at the younger range. And benches, more benches around town, and particularly in some of the harder to reach areas like around the housing authority that is at the far end of town. I can't remember the name of it right now. Cindy, do you remember which one we're talking about?
Seabeds.
Seabeds, yes. Seabeds, yes. Okay, next. Worry about cost of living. What we see is that there are a small number of, or a small percentage of people who are very and extremely worried about the cost of living. But it's important to see just how many individuals we're talking about, that it's close to 100 folks, older folks in living in Needham, who are very concerned about the cost of living. So these are questions about food security, food access, food preparation, and food security. You can see that people had trouble getting access to food. A lot of people, again, cite transportation as being an issue there. A fair number of participants feel that they are not able to prepare or cook food. And then people are concerned about being able to afford balanced, healthy foods. Next. Access to healthcare in the previous 6 months. You can see that there was almost 20% of the participants had trouble accessing healthcare, while 72% had no problems. So transportation needs, we asked people what it is that they need transportation for. The medical appointments and visiting people are critical, and shopping is difficult for people without transportation. Isolation, yeah. If people have questions along the way, please let me know. Otherwise, we'll take questions at the end. Isolation and loneliness is a real concern for those of us in public health and in aging services. And so it's interesting to note that about 70% of the participants do not feel isolated and lonely, which is heartening. However, we have the 5% who feel lonely and isolated very often, which is of great concern. We asked this time around, we asked questions about comparing experiences before and during the pandemic, since this was during the pandemic. There were some people, interestingly, who felt less isolated during the pandemic than before. Wait, am I reading this right? There were people who felt better connected because of the use of Zoom and technology. Others felt about the same, and there were a smaller number who felt lonelier I am, for some reason, having trouble reading this chart. Cindy, help, please. The less than, but less than before the pandemic. I'm sorry, Cindy,
But
please.
showing that they are interacting more is the 8.5% than before the pandemic, but they are interacting less now than they were before the pandemic.
I'm
But
sorry
some are about
this.
the biggest proportion is about the same.
Yeah, sorry about that, folks. Okay, I think this is what I was thinking about when I was reading it, which is why I was having so much trouble reading that one. So this is the chart that compares feeling isolated before the pandemic. And there is that 7.4% that feels much less isolated. And that was the group that I was getting confused by. And then there were the 36% of the group that felt more isolated during the pandemic. Not surprising. Limitations to this assessment. We did not specifically examine diversity, equity, and inclusion. If we do another survey, it'll be really important to ask more pointed questions about that. There were underrepresented groups, of course, Black, Hispanic, and Asian, and potential language barriers. And next steps. The findings are being incorporated into the overall community health assessment, which we hope to have complete soon, thanks to amazing work done by Julie. There are next steps in terms of action steps that we can take based on some of the information from this assessment. We want to encourage more older adults to conduct and request safety audits. Although that program is on hold right now, identify additional benches for the community, increase awareness among the older community about tax relief and transportation programs. There were a fair number of people who didn't know what was available. For programming changes at the Center at the Heights, we would suggest that the staff seek more input from younger seniors. And we clearly need to employ some creative outreach to identify and reach out to isolated seniors. And I think that's the conclusion.
Thanks, Lynn. I mean, it's really important data, I think, that you all have collected, and I thought your next steps were good and actionable. I did have a question about the kind of that outreach to those who are feeling isolated, but even just the issues to explore there. And I'm curious if there's, more of a plan around that piece. And the reason I ask is one of my colleagues is the chief medical officer at AARP, and I know they've been doing a lot of work in this area, resources and so forth. And so I'm just curious if we have more, concrete ideas around that isolation piece, since it is such a big effect on health for these seniors.
It's huge. I agree. Really huge. I believe that the folks in aging services are spending some time and energy focusing on that, but I would defer to Tim or Ed even to answer that question.
Ed, I see your hand.
Yeah, I did have a question, and I may have missed this. In terms of the total participants, what population or where did most of your surveys get returned from? People who regularly use the CAF? Was that the largest percentage of return surveys?
I
Or don't you know that?
we don't know that.
Okay. I
We
was just
could-
thinking,
We could kind of guess maybe a little bit by just the age groups that tend to use the CAP and who responded, but we didn't specifically ask about their own participation.
okay, thank you.
And Ed, did you have any follow-up comment on the issues of isolation in terms of aging services or other activities going on?
Not really, no.
Okay.
One of the programs that the senior center was most proud of, and it was a collaboration between aging services and the community council, was their tablet for seniors program. So they would use grant fund to buy a tablet, and they would use grant funds collaboratively to hire staff to do essentially trainings showing seniors how to use their tablet for logging into classes at the CATH, for FaceTiming or video calling relatives. So that was one thing they really tried to do, in addition to expanding the meal delivery programs during the pandemic. In terms of sort of post-pandemic and other ways to address isolation, we've tried to expand the type of rides we're offering. So we've brought back grocery shopping, we've brought back trips to pharmacies. We're starting to reinstitute sort of the larger trips where they go to a museum, they go to a casino, that sort of thing. So there have been some efforts, but I think it, as the data shows, there's still a ways to go in that regard.
Well, Tim, if there was ever an interest, in sort of learning more about what AARP is doing in the space, because it's a big focus. And my colleague that I mentioned lives in Newton, so like she's a local,
Okay,
so I could easily connect you if there's ever interest in that.
that'd be great.
Hi, again. I wanted to bring up something about that tablet program. I know several people who actually were participants in that, and they were really very happy with the program and very grateful for it.
We
That's
think that has something to do with the change in the response methods as well, that more people had access and were comfortable with computer technology.
Mhm.
I think Rob's been trying to ask a question.
I'm sorry, Rob, your hand is, or you're not on my main screen the way my computer is, so go ahead.
You'll need to reorder your screen.
I know.
I thought one of the things that should be included in next steps would address food insecurity. It looks like there's 5% of the respondents were extremely concerned about food insecurity and other issues around food, and probably it looked like around 12 to 15% overall were at least somewhat concerned. We already have a very successful program in traveling meals. So I was wondering if, that's a way that we might be able to address those needs that we just identified. I don't know if we're not identifying those folks or if we need to do more outreach, but that would be something I'd like to see in next steps. And I think we may have a program in place that can address that.
Thank you. That's great.
Kathleen, hi. So I just had a question. I'm interested in the isolation and loneliness slides. We ask sort of subjective questions on, do you feel more isolated or not? Do we have any metrics that are, how many people do you see in a week compared to last year versus the 2016? Like, I think throughout, I keep wanting to know, well, what was it like in 2016? And so is there sort of a time analysis that maybe even later we can do with those data to look at the difference over time?
We can take a look at that. That may be actually addressed in the body of the report. I'll take a look at that more closely.
Okay.
Any other questions? I have fixed my screen, Rob, so I can see you now. Okay. Lynn, any final comments that you want to make?
No, thank you. I think this was a really valuable project, and I'm really happy that you folks have received it.
Thank you.
Thank you.
All right, let's move on to staff reports. I think we're starting with accreditation with Cindy and Lynn.
Are you going to pull up the?
Do you want me to
report?
go?
Yeah, sure.
Um,
We're just waiting for the report to come up. Go ahead.
the accreditation team, along with steering committee members and other members of the staff, has been very engaged in a lot of different efforts simultaneously. You'll hear more about the strategic planning that has kicked off later on. Of course, wrapping up the senior assessment, finalizing the workforce development plan, excuse me, and kicking off a brand strategy development, which we mentioned during the last meeting. But ultimately, our goal with all of these projects and for the Public Health Accreditation Board is to submit the readiness assessment, which is a very thick document about this big that goes through all of the standards and measures. And we do somewhat of a self-assessment based on the materials and items that are in place. And the goal is to submit that by the middle of September so that the accreditation board can provide feedback and tell Needham if think we're ready or not to move forward with the full application and submission of all the documents. So from there, there'll be a year to finalize and complete everything. So that's the next, while all these projects are simultaneously happening, that is another big thing that we refer to in the report called the readiness assessment. Lynn, anything else to add?
We have started working on a branding strategy with the help of consultants from More Advertising. And one of the biggest things on my mind actually is that Cindy will be leaving us at the end of this month. And we are making the best use we possibly can of her remaining time and anticipate really missing her when she leaves. Really have appreciated having her as part of this team.
Thank you.
Cindy, thank you on behalf of the board as well.
Thank you. It's been wonderful interacting with you all.
Yes, thank you for all your work.
Thank you. My
And then-
pleasure.
Wanted to mention where you're going.
I am in the middle of August. I'm going to be starting a full-time role with CDC as the team lead for training delivery, but based in Boston. So I'm very excited to have the opportunity to work for the agency. I worked previously years ago for them. So I'm excited to start the next chapter and return, but still be in the Boston area. In the past year and a half with Needham has been invaluable, especially being at the local level and going through the accreditation activities.
Congratulations.
Thank you.
Yeah, congrats.
That's terrific.
Okay, any questions for accreditation? All right, let's move on to traveling meals.
I'm gonna start promoting more of the staff to come in. I think Rebecca probably had to go and start some of her deliveries. I guess I'll just go over briefly. You know, we have transitioned from volunteer driven deliveries to our summer sort of program, which has paid summer drivers. As you can see, for every month except April, we've been above
Your screen
our.
is not sharing right now, just so you know.
Okay, I apologize. Sorry about that. For every month except April, we've been above our 22 level. So 23 was a very busy year. I think having the pilot agreement close to being signed, which would guarantee us sort of 2 years notice and require a written sort of notice if the hospital is going to sort of terminate providing the program, gives us some needed security. I don't think it answers the medium and long-term questions, but at least answers the short-term questions. So we're very fortunate to have that. Tara, is there anything else you'd like to add from a traveling meals perspective?
No, Rebecca didn't have anything to add to that, so.
Okay.
And Tim, just so I understand, so we pay the drivers in the summer, you said, is that because the volunteers tend to not be around, or is that?
Historically, yeah, the volunteers often were retired folks who had, Cape houses or would go away for substantial parts of the summer. So that's why we've historically paid summer drivers. It's actually changed a little bit now. We have some drivers that are on the younger side, but often historically it was school nutrition staff who worked in school cafeterias during the year. Were looking for some summer work and often picked up assignments with us. Ed?
Ed, do you have a question? I think you're muted.
Yeah, I am. Sorry.
Right.
I just wanted to mention, there was an article in the Needham Online paper, The Observer, about the traveling meals program.
Mhm.
And I thought it was a very well balanced article. And I know Tim was mentioned in the article several times. And so if you hadn't had a chance to read it, I think it was about 2 weeks ago now. It's quite well done.
I thought it was too. We were fortunate to have a good reporter to talk to, and he was very thorough. He followed up with quite a lot of questions and follow-up questions. So it was nice. I mean, I think we've talked before, one of the challenges we have in public health is we're trying to educate and inform the community, and not having a newspaper for a long time was a real challenge for that. I'm really excited that there are now, I think there's two, the Needham Observer, and then the Needham Channel is also, who has been a longtime partner with video content, is also reaching out in some print ways. So that's exciting that we have more people actually covering government and policy and functions that affect the town residents.
Tim, is there, in talking with them, I think it's been a great addition to the community to have that. Is there a opportunity to sort of have a section every issue or something like that? I know they're covering a lot of the government, agencies and the select board and all kinds of things, but I just wasn't sure if that's something that might be an opportunity.
I'm happy to talk to Peter or Frederica or some of the other folks. I know they're very interested in covering government and sort of the functions of the town. I do think it's a little different than maybe, the Hometown Weekly and near the end, the Needham Times were very much in the, you could send them anything and they would print it pretty much.
Yeah.
I don't think the Needham Observer is sort of looking to do that. I think they're actually looking to do, critical reporting that does ask questions and doesn't sort of take fluff pieces. But we certainly have a lot of work that's going on across health and human services, and we're happy to sort of pitch them ideas of content that might be interesting, like the senior survey, or when we release the community health assessment. The aging services got a grant to continue its taxi rise to medical appointments program, a $50,000 grant. That's a big thing. Obviously, we know the health department, we're doing work to share services across communities. So there's a lot of interesting topics we can definitely talk to them about.
I think we have tons of meaty stuff. So, feels like it's a good opportunity to help get the word out.
Yeah, I just wanted to mention too, I run into Peter O'Neill sometimes 2 or 3 times a week. And I could also feed him some information if probably through Tim would be the best way to do that. But it's a good way to get health department information out.
Yeah, definitely.
All right, let's move on to emergency management. Michael.
Good morning, everyone. So our active shooter exercise that we conducted in May with Babson and Olin colleges in the town of Wellesley, and Wellesley College was represented there as well, was very successful. Everyone was collaborative and talking with each other. There's a lot of good conversation. So I have that after action report drafted. It's being sent around for review right now, and hopefully that'll be able to be distributed to the players by the end of this month. Also in June, we conducted our EOC functional exercise. This was the first time the EOC had been exercised in a functional exercise since before the pandemic, although obviously the EOC had been stood up during the pandemic. So we got a lot of good inputs from that exercise, items to refine our standard operating procedures and our comprehensive emergency management plan. This was the first time that we had activated the Emergency Operations Center in its new location at the police station. So that was a very valuable exercise. We also completed our grant funded hazmat training. There were 19 DPW workers that received training as well. And that includes all of the staff that works at the RTS, which was the finding from our hazmat tabletop exercise last year. We had scheduled with the contractor for 4 sessions, and it only took 3 for the DPW staff. So we were able to open up the 4th session to other departments in town, and both Virginia and Cy were able to go and get training for the health department. So it was nice to be able to take full advantage of that training while we had the instructor to get more staff than just the DPW staff trained.
And Michael, are there any key findings from that active shooter exercise that you're able to share at this point?
So there wasn't anything that was too surprising that came out of the exercise. The biggest challenge is that the Babson College Police cannot scan the Needham Police radio ever since the Needham Police went digital on their radio. So Babson has a long-term plan to fix that. But if something were to happen, all 3 departments could communicate through the Wellesley Police radio channels.
Any other questions for Michael? Okay, thank you.
Thank you.
Let's move on to emergency preparedness. Tiffany and Talib.
Good morning. We continue to coordinate at local and state level to provide trainings to volunteers. We had last month active shooter training, and we had 20 people attended the training, including staff members. And we are going to follow up with the Needham Police Department to run a drill on September. I attended the WebOC course hosted by MEMA, and this course, among other requirements, by MEMA's Emergency Preparedness Management Professional Program. 3, reviewed draft emergency shelter plan that we received from the consulting firm to provide some more contents and feedback. For example, such as filling MRC assigned staffing positions at shelter site. 4, we continue to work on the associate documentation for domain 2 standard 2.2. Last at June staff meeting, we provided demonstration of the voice translator device to staff members, and on how does it work, operate, and other useful information. Afterward, we created a policy for using that device. Thank you.
Thank you. Any questions?
Quick
Rob?
question about sheltering animals. And just wondering which animals in our current shelters, like for heat emergencies, do we allow animals?
For the shelter itself, we only just allow the surface animals. But for pets, other pets, we should have a separate shelter for them.
So warming and cooling centers are not required to house pets, but shelters are. So if we had to open an overnight shelter, we would be required to find a space for pets.
Okay, thank you. Let's move on to epidemiology. Julie.
Hi, good morning. Okay, I just have a few brief updates. So as Lynn and Cindy sort of quickly mentioned earlier, I'm working a lot on the community health assessment, sort of in the phase of incorporating feedback from the accreditation steering committee into the document and working to sort of finalize the data that we're including, and then we can go through more of the nitty-gritty of the document. Ginny and I had the sunscreen dispensers installed thanks to help from the Department of Public Works, which was really exciting. 4 dispensers were installed this year that we're calling a trial year, mostly because we got this ball moving a little late. So there are 2 at DeFazio, 1 at the pool and 1 at Greensfield. When we posted on social media about installing the dispensers, which I included in the the bottom of my update there, the response was really overwhelmingly positive. People were really excited about it. We put out a super short, just a few questions survey that we'll keep kind of sending out to people, mostly just to get feedback on whether the locations were good, were the dispensers visible and all of that, so that we can improve the process in the future. And we're continuing to post on social media and the website about sun safety to keep promoting the dispensers. We're trying to keep up with the social media accounts the best that we can. So I think our biggest success has really been Instagram. We're gaining a lot of followers. I think it's been a really positive experience, and we're able to share a lot of great stuff that our department is doing and, miscellaneous public health topics. And actually, when we posted about the sunscreen dispensers on Facebook, the metric said that we had reached about 6,300 people, which is actually really exciting because normally we're looking at very small numbers, and we just have to hope people are looking at it and appreciate the content. So I think that's all the updates for me, unless you have any questions.
The sunscreen program.
Go ahead, Rob.
Sorry, I was going to say the sunscreen program sounds like it might be an item for the Needham Observer because it's new and it's clearly very popular. And I, as has been said before, I think it's a great idea.
Yeah, that's a great idea.
And I'll just also make the plug from our previous conversation to look at time trends on the 2 surveys for the older adults. So thanks.
Well, and it'll be interesting to see as you look at how often the dispensers need refilling, because that'll be a nice way to track usage.
Yes, agreed. And right now, again, because we got the ball rolling kind of late, we weren't sure how to manage that. So far, Ginny and I have just been going to the locations and checking it out. And so far, I don't think the use has been as high as I think I would hope. But again, I think we just have to keep getting the word out that the sunscreen dispensers are there. I think another concern from people too is what exactly is the sunscreen? And I think maybe we need to do a better job communicating what the ingredients in the sunscreen are.
Yeah, I think that would probably help quite a bit. But it's a great program.
And also, is there information on the these units that, if you leave your sunscreen bottle sitting in the hot sun, that's not good for the sunscreen, right? Are these insulated, have a UV coating, or do you know what I mean? Do we know how well the sunscreen maintains its integrity sitting in the sun?
It has a filter on it, almost like a blue-ray filter over the window. So you can still see if it's being used, and also supposed to be protected from the sun. We checked them yesterday, like Julia said, and we were just plugging around with them, and they seemed cool. They didn't seem too hot when we checked them, right, Julie?
Oh, okay. So. Yeah. And when it comes out, it's not separated. It's still
it's still nice and thick.
Yeah.
I end up applying a lot of sunscreen. Every time we test it out, I end up just covered in sunscreen.
Yeah. Okay. All right. Interesting. Cool. Thank you, guys.
I
I
understand.
wonder if we get more use in the fall when like there's more sports teams at the Fabio and so forth, in like September, or late August. But anyway, sorry, I interrupted somebody. Oh, Stephen, go ahead.
Yeah, my understanding is that's a mineral, non-chemical sunscreen, so that should not be affected by UV.
All right, thank you, Julie and Ginny. Public health nursing.
It's a good segue for me. So just going off of what Julie said, we had really great response to the sunscreen dispensers. So I'm really happy about it. I'm glad we did this. So we had multiple CPR classes and they were all well attended. We still are offering COVID vaccines, but the interest has really gone down significantly. This past month, we only gave 3 doses. So we're still putting it out there. We're still offering it to people. We still have a good supply left over. As far as DVAC, they had a DVAC conversation for the public library staff that was very well received. They have one scheduled for this month and next month. They're also working on their cable spot for October. We also had a COVID cluster at a local hospital, but the ID department was in touch with MDPH and I haven't heard any other updates. So my understanding was they needed a week's worth of negative testing before they can take off their masks and kind of alleviate their COVID regulations. So I haven't heard any further updates from them. So I think they're okay now. And I have talked to ID, no other updates from them. I also licensed 8 camps with Tiffany's help. I have 3 more coming up in the season. And that is all for me, unless anybody else has any questions.
Questions? Okay. All right, let's go to shared services.
Hold on 1 second. There we go. I'm joining on my phone because on my computer, my integrated camera decided to fail on me. Of course, on my last day, it's perfect. But we've been doing really well with the shared services. Hold on. I'm gonna exit on my computer because this is being annoying. Okay. So for shared services, Roland has helped out a ton with inspections for the environmental health team. He was helping Tara and Sai with that catch-up work as there was a little bit of a gap between Sai and Allie leaving, but he helped out a lot with various types of inspections. I was in the process of finalizing getting the licenses for Food Code Pro, Housing Code Pro, Pool Code Pro, and R360 for our district. Right now, I have our contract signed for Needham, and I got the contract signed by Sherburne. Dover, I believe, is still waiting for their permanent town administrator to take position before signing any paperwork. I know there was a little bit of pushback from one of their Board of Health members about the programs, but Jason, their health agent, said he was working on that piece. So we're waiting for them. And then Medfield also still waiting for a response from Bridget Sweet on their licensing paperwork. The MOU has been signed by Needham and Sherburne, and kind of the same thing. Medfield, I was told everything was signed. I just haven't received a copy of it. And then Dover, again, waiting for their new town administrator to take effect to finalize their signatures. For contact tracing, Michaela Buca, her last day was June 30th. So we're no longer doing contact tracing for any of the towns. I think we were probably the last district in the whole Commonwealth that was still doing contact tracing. But Michaela was awesome, like very, very great at what she was doing. But at this point, it doesn't make sense to continue, but wish her good luck in her next endeavor. I think she's going to be working with MRC is what I was told. So that'll be great. So we'll see her in other ways. Yeah, so today's my last day with the town of Needham, which is very bittersweet. I know I sent out an email earlier this week, but you guys will I'll still be involved pretty heavily because I will be the new Assistant Director of Shared Services for DPH. So I am happy about that because I will still get to see Tim and Kristen, Tiffany, and everyone else. Will probably see me in different meetings. So that's exciting. I'm going to be starting in mid-August. So I'm excited because I'll have some time off for once, which will be nice. Hopefully I'll actually get to relax.
We just have to make sure we're really honest in our reports because Diana will be able to spot any BS.
Yeah,
Well,
thank you, Diana, for everything that you've done. You've done a terrific job.
Thank
And
you.
congrats on the new role. Great impact at the state level, so that's exciting.
Yeah, thank you. I just think it's funny because on the side, I'm like finalizing the spending report for FY23. So I'll just like look at it later, like who did such a terrible job at this? Oh, wait, it was me.
Yeah, thanks a lot. You've really been like a linchpin for our group these years, like many thankless jobs that you have undertaken over the years. We appreciate it. Do we know where things are, like we're looking for a replacement? I mean, we've got a lot of momentum going and be ashamed to lose it.
So Tim, do you want to give that update or?
We do have, we have quite a lot of money between our different shared service grants. We have a manager who's going to sort of be replicating Diana's role starting the 24th, so a week from Monday. We have sort of an assistant manager of shared services and lead trainer for our training hub grant that's going to start August 14th. And HR is right now sitting on, I think, 4 or 5 job postings that we hope to have up in the next couple of days. We have a lot of people we're going to be hiring. But, it's going to be, we're definitely going to feel the loss of Diana and Cindy. Even if we bring on other people, it's not going to be easy to replace them.
All right, any last questions for Diana?
No. Also keep an eye out for the advisory group. So that'd be Tejal and Ed, I think would be getting that first invitation. So I'm not going to be sending it out because I realize I'm like, it doesn't make sense for me to hold the doodle poll and like have that information, but we are planning on hopefully having that first advisory group meeting sometime in September. So after Labor Day, because I know with summertime, it's pretty hard to schedule a lot of people with vacations and everything. So we figured early fall will be good. So the advisory group is exactly like our working group where at least one representative from each town is coming together and we can decide. I think the first one will probably be in person and then from there decide between in person and virtual and then rotating meeting locations between the towns. And I believe the plan was to do a quarterly meeting just to check in and give updates on, the status of shared services and what we're doing. And then that's also the opportunity for each town. If there's a certain project that comes up, like we would do voting and everything at that meeting.
Just to clarify, I think it's Ed and me.
Oh, sorry. Yeah. Sorry, Ed and Kathleen.
Yeah, unless Tasia wants another job.
I was happy to read that in the minutes. Usually when you're not at a meeting, you get
We did
nominated.
not volunteer.
So scratch that. Sorry. I was like, thinking because you're the chair right now. No, but it was Ed and Kathleen.
Yeah, no problem.
All right, thank you. All right, let's move on to substance use prevention grant. Carol and Lydia.
Hi, good morning. Last month on June 13th, we had our third Mass Call 3 strategic planning meeting, the third of 3, so it was our final one, and it was focused on strategy selection. We had about 30 participants at each meeting, which was a good turnout, including a lot of staff that's on today, and Dr. Brown was at some of the meetings, so we're really appreciative of everyone for their participation. And we're working on sharing that feedback with our TA providers at BSAS, Bureau of Substance Addiction Services, and then with their approval, we can work on drafting a logic model and implementing those strategies in the coming months and throughout the rest of the year. We are also continuing to work on capacity building and collaborating across the 4 towns, Dedham, Needham, Walpole, and Westwood. And we have mentioned in the past our upstream prevention, social media, and movie theater ad campaign. The theater ads just ended. They ran through June and ended at the beginning of July. And we are waiting on some data on number of impressions, ticket sales, and then we'll be able to share those. But our social media campaign, they have been collecting really detailed data for us. We get a weekly report on impressions and the reach and profile visits of the campaigns, and they have town-specific data, and that's been really helpful. So we wanted to share some of those from our most recent meeting. Just to explain some of the terminology first, impressions is number of times that your post was seen by someone. It could be the same person, or it could be different individuals. And then reach would be the number of unique accounts that have seen your profile. So impressions might be a higher number, but it might be repeat viewers. So in total, between Instagram, Facebook, and YouTube, as of, let me look at the most recent data, sorry. We have had a total reach, so unique accounts, 145,000 since I believe we began in May, was it, Carol? So that was a lot of accounts in a short turnaround. The agency we've been working with, Yelling Mules, they said that these are good results for the project that we're working on. So we're excited by that. And total number of impressions, which would be views by anyone, including repeat views, is 710,000. With total clicks on the ad, taking the viewers from the ad to our website, being around 4,000. And total amount spent on ads on all 3 websites has been $2,300. So we are looking at kind of how we could take on this process by ourselves or reduce costs, and then hopefully we'll have some good information on social media marketing to share with the rest of the department, and continue to show the effectiveness of this campaign and be able to do similar work.
Right. And what we found through our 3 strategic planning meetings and surveys is that the regional team supports this kind of messaging to adults and parents and other people involved in youth lives, to give them the skills to be able to start those conversations and what to say and resources. So we've been working this week and gathered a lot of different resources, Addiction Policy Forum, things from the CDC, to start to create as posts to keep this going. If in fact we don't have the support in our budget for Yelling Mule, I think we've learned a lot. And Lydia's done an awesome job. It's been great because many parents and adult caregivers feel like alcohol use is inevitable. It's a rite of passage. And just having the opportunity to see that there are places you can go to start the conversation, tips, words, easy. We're hoping that from what they told us, the reach and the impressions has been impactful. We work with an evaluator, and we're going to be talking about how we can evaluate this other than, the quantitative data. So, and I know, I appreciate you having us and talking. I just want to say, we work, as you know, April 13th, Alcohol Community Forum. You may have seen the Washington Post article today about alcohol-related deaths and the CDC data on all 50 states having alcohol-related deaths increase from its 2018 to 221. I'm going to wrap up in a minute. We are a part of the Mass Alcohol Policy Alliance. It's a volunteer evening group, and David Jernigan and Liz Parsons co-chair that. David has created a resolution that supports Rep KCON's alcohol tax increase, which we know in Massachusetts is long overdue and is a strategy that reduces alcohol intake. So I've spoken to Tim and Tiffany, but I'm also going to present the resolution, and we're trying to get as many boards of health and departments around the Commonwealth to sign on to that to support RepCon's alcohol tax, which she tries every year. So thanks for listening to that, and I'm hoping we can share that with you all for your consideration.
Sounds good. Looking forward to having you come back and do that. Okay, substance use prevention, Karen.
Good morning, everybody. Nice to see you all. Thanks, Tim. Oops. Here we go. For the month of June, we wrapped up the coalition year of activities with our spring coalition meeting. And we had about 15 people come and join us to really reflect on the accomplishments of the coalition and to honor the volunteerism from our coalition membership. So we were really pleased to be able to share that meeting with our community. In addition to that, we started in May our strategic planning process with the help of a consultant, Amanda Decker from Bright Solutions. And we've now completed 2 of those strategic planning sessions, and we have 2 more scheduled for this summer, one for July and then one for August. So we've been very excited to be able to have Amanda's facilitation of this, because it gets more anonymous feedback from the coalition members, so they feel free to give their input on questions around the priorities of the coalition, the mission. And we'll be talking about the structure of the coalition and as it relates to the goals of the coalition. And then hopefully too, working toward a strategic plan that will update our logic model and strategies that we'll be looking to implement this coming year and beyond. We finished the work with Boston Filmworks for creating a SPAN educational and awareness video about the coalition. So we'll look forward to sharing that with you soon. We're putting together our marketing plan on how we want to share that in the community. And another event that we are participating in the planning for is the Needham Overdose Awareness event coming up on Thursday, August 31st. I know last year, several members of the Board of Health were able to attend, and we extend that invitation to you all again and appreciate your consideration of that. Deb Schmill of the Becca Schmill Foundation is our lead on planning that event, and our department will be represented there with resource tables from both public health, nursing, and SPAN, the coalition. So we'll extend a formal flyer to you so you can have the details for that, but it is on the early evening of August 31st. I'm happy to report that we have a new member of our prevention team, Vanessa Ronsky, who started at the beginning of June. I'll have her come to one of our future meetings so you can meet her in person. But she has replaced Jasmine Hurley on the Stop Act grant, and we're delighted to have her. She's jumped in with both feet readily. Just very quick note, SALSA completed their school year, and another record year of service hours, completed 1,661 hours among 122 SALSA members. So we're really heartened and grateful for the momentum that program has continued to show in the high school. And SPAN appreciates all of the opportunities to collaborate with these students, because without their voice, really our work wouldn't be as meaningful. And just finally, a quick mention that we met with the school leadership last month, a couple of members, the director of wellness, one of the assistant superintendents, and the director of health services. Tiffany and I spoke with them about the optional questions for the upcoming 2023 administration of the Metro West Adolescent Health Survey for grades 6 through 12. That's scheduled to be held again online this fall in the schools. And we had a very collaborative meeting with them, and we're pleased with the results of the questions that will be added to the Metro West survey as part of the Needham specific surveys. And we have maintained the questions that we need for our grant purposes and following the data trends that we've been tracking around perception of harm and parental and peer disapproval of use and other types of related questions. So that's all I have for the month of June. If anybody has any questions, please feel free.
Questions for Karen? Okay, thank you.
Thank you.
All right, and moving on to environmental health, Tara.
Hey, good morning, everyone. Sai is off today, so I'll be doing the environmental team updates, covering a couple for him as well. So to start off, we had a very busy month. We're making some headway on our FDA standard adoption for 6 and 7. So as you know, I mentioned that we hired a summer intern, Madison, that was due to start on June 5th. She's with us now, and she's been helping us keep our momentum going for these standard adoptions. We had our auditor in, Ruth Clay from Melrose Wakefield. She's great. Had a couple more paperwork items to get completed. Standard 7 is complete. She's going to come back the beginning of August and sign off on both 6 and 7. We had a couple more paperwork items to gather for 6. Again, standard 7 is our standard where we basically bring our stakeholders in. We have our annual food advisory board meetings and things of that nature. So we continue to do that every fall. So that's the standard 7, and standard 6, as you all know, is the food and code enforcement policy piece that we approved recently and that we're rolling out to be enacted on November 1st. So we basically are having that right now roll out to our food establishment, permit holders, stakeholders, inspection staff, making sure everyone is well educated on that, as well as the grading initiative that will be piloted coming up in November. So a lot going on for the environmental team, and Madison has been great helping us with that. ECOM also has been helping us promote the Food Safety Excellence Program. Both Madison and ECOM are doing PSAs. Madison did one last couple weeks ago, and ECOM's actually doing one today on the food grading. So we're working with Needham Cable, making sure that that's going to be, upcoming, that we'll be getting that information out to everybody so we can have a smooth transition into that program. So that's exciting. We also, I want to report Monica Pinkary, our part-time food inspector, and I attended the annual Association of Food and Drug Officials conference that was in Norfolk, Virginia in mid-June. It was a great conference. Again, you get a lot of great information. We had a great FDA standards workshop that basically ran through everything on how to maintain the standards, because that is going to be coming up next. The last standard we'll have to adopt is standard 8, which we're going to be doing in the near future, as well as maintaining the standards that we've accomplished so far. So that was a very helpful conference for us. The other thing I want to mention, the Nutritionally Needham program, we're making some headway there for this year. ECOM has been working with us on that and getting great feedback from establishments, owners and managers about wanting to take part in this program, which we're looking to expand for the month of October. We did it a couple of years ago. Last year, it didn't get off the ground. A couple of years ago, we did it for a week in October, as you may recall. So now we're trying to expand it for the month of October. So we're going to be, again, getting that information out, and ECOM is working with the restaurants that are looking to want to take part in that program. Looks like we have about 17 or so restaurants, which is more than we had a couple of years ago, that are interested. We're still trying to get more people in wanting to take part in that. So that's another thing. Again, Cy has been great work helping out, great fit to our department. We're really happy with his work. He has been getting out the permit renewals for the animals. We did the marijuana, medical marijuana dispensary permit renewal. So Sierra Naturals is all set. We did that, as well as the Needham Farmers Market. Again, we're having Cy, and also he's working with Madison and doing those inspections every week. So we're working with the food vendors and making sure they're offering safe and food items at those market events. Cy also wanted me to mention that for the rice barn, he is still kind of chipping away little by little. He's looking to install a mop sink in his establishment. Again, Cy is encouraging him to work with a licensed plumber and to also make sure he works on those items from the building department. So again, we're still kind of struggling and getting that him to have his licensed professionals work with our building department and pulling the proper permits for these items. So we keep pushing Charles and encouraging him to work with building on that. So that will be something that we'll continue to do, and we'll see what happens there. And then he also wanted to mention the new Roach Brothers on Chestnut Street. They're looking to do a soft opening the end of July. Like basically they're moving forward and getting that store prepped and ready for us to do a pre-operation inspection towards the end of July to allow them to start making their way to open to the public. So that's coming along. So and then the only last thing I had to mention was the annual site visit that Cy, Madison, and I did at the RTS. So this is something that the board, you wanted us to do on an annual basis. We met with Matt Damaris, who's the superintendent, and he was great. He had his staff meet with us. He gave us a tour of the whole facility, showed us all the good work that they're doing. It was very educational, and he agrees that it would be good to have us collaborate this every year and have an annual check-in with them. We can help them promote items that they're doing, like their compact posting program and other things, the sharps disposal unit that's held over there as well. So he was very happy with that. So I think those are my main updates. Unless you have additional questions, let me know.
Any questions?
I was going to suggest, just for Nutritionally Needham, do we suggest like offering a non-alcoholic beverage or something like that as a health? It's kind of a way to tie in our two areas, and alcohol is definitely empty calories. Of course, a lot of the mocktails are pretty sweet, but I don't know.
Oh, that's a good idea.
Think about.
Sure.
Okay, and so the issue with Rice Barn, it appears that he's maybe doing plumbing without pulling the correct permits. Is that, or we don't know?
No, but it is one of these things we're struggling with, because we usually do like a weekly checking with the building department, mainly, Larry DeBona, the plumbing inspector over there. We just check in. We say, have you heard from Charles's licensed plumber yet? He's like, he basically, every time we check in, he's like, no, I haven't heard anything.
Okay.
I'm trying to encourage him to work with a licensed plumber. So it's kind of an ongoing conversation that we keep encouraging Charles to have his licensed plumber work with building, but yet no permits currently have been pulled to date. But this
Because
is
the
kind of-
risk is he does some plumbing work, it's not correct, and then he has to, goes to get the inspections, he has to fix it again. Okay.
Correct.
Right.
Yes. And building is aware of this. This has to be addressed correctly before any approvals will be made. So there is that catch. So.
Okay, thank you.
Okay, looks like no other questions. Thank you, Tara. And then I think you're probably leading us through these other items that are also on the agenda.
I think Tim and I are both. Yep.
I want to start with the testing, the turf testing, Tara.
Yeah, so as you can see, we had our annual turf testing report that was submitted. Only thing that was a little bit different was there was a couple hits of zinc, as you saw. However, some of these components we had hit on in previous years. So, when I talked to Wendy, the lab contact I have over there, she said it didn't seem concerning as far as anything that was hit on these additional zinc measurements. The only other thing she wanted me to let the board know, and I also let Tim know, is that they had a problem with their blank field test. So the person that Cy and I met on site when we were doing the grab samples of the fields, I guess he had not put those grab samples in a sterilized jar or something like that. He had to put it in a special jar for the blank, which he did not do. So they were very transparent with us and let us know that that was not handled correctly. They adjusted the amount that they charged us to not include that blank, but they did do the blank for the lab, which I think is what we wanted them to do, because we got a hit of acetone, the other report from before, to kind of negate any risk of that not, being a lab associated contaminant. So those are the two things she wanted me to share with you. So unless you have any other questions.
I would just point out that we're reporting ticks, right? So the acetaldehyde is a tick, right? Which is a tentatively identified compound. The concentration is not really valid. It's an estimate. And having done them side by side, where I have a real result from TO15, sorry, I'm getting into the weeds, and a tick, they are not close often, right? Now, I can't speak specifically to acetaldehyde, but I've looked at other compounds. So in some ways, I think it's problematic to put that on a table with a reporting level, either from EPA or, you can just say it's identified. Now, if we keep identifying it as a tick, that may be something we need to add to the analyte list if we really think, we don't think there's really a problem here, but that's the reason you run ticks. It's to adjust your analysis list. I mean, at some point we have to decide when we stop doing this, or do we just keep doing this forever? We're not seeing big issues here, and we haven't. We've been doing this for a long time. But if we're going to continue down this path, then we should probably be more specific, in how we analyze for that compound. Right, because that keeps showing up. We don't see the past data, right?
Right, correct.
Which is common in the environment. It's everywhere. So,
Yeah, I agree. If it's not helpful data, we could have them take that off. Sorry.
I mean, keep it in the report. Sorry, go ahead. Can't tell who interrupted.
Sorry, I didn't mean to interrupt. I think acetaldehyde came up high last year, and it just in comparing last year to this year, it didn't seem like there was a huge material difference in what was found. I totally defer to you, Kathleen, on the ticks, and if we go forward, whether we should change what we do.
It'll cost more. It's another analyte.
And I guess
everything costs more.
The other comment I wanted to make about zinc is that, of all the metals that are out there that can contaminate things, zinc is one of the metals that is felt to cause the least amount of toxicity to people.
Yeah, agreed. And it's right on the edge of a residential standard, right? So, I mean, and no one is living on this turf. So, anyway, okay.
Is the best practice here, or the standard, I guess I would say, to do this annually, or like if you're not seeing significant changes year over year, is there any option to maybe do it every other year? I'm just curious what the best practice would be.
I wouldn't say there is. I mean, this isn't my specific field either. I mean, I do air monitoring in certain places, but not like people don't monitor turf forever. I mean, they've done usually people. It was a question that people in the community raised. You would, sample for a while. We've been doing this how many years? 10 plus, longer. So that I mean, I guess we could go do it every couple of years if you felt like, just to make sure there isn't a change.
Just because it's an expense, and if it's not really bringing us value, I think it's worth considering that.
I would agree with that. If the field, if the fields aren't changing in any way, obviously if the field gets redone and they put down new crumb rubber and things like that, different story. We should test that, but
Which is what we did here, right? There was the whole idea is put this in place. So I don't know how many years the new stuff has been down. Do we know?
It was fairly recent, within the past 3 or 4 years, right, Tim?
But we
But they-
have 3 or 4 years of data.
But they do,
Every other year.
they do refill that, infill that rubber plastic, you know, those rubber.
Oh, that's true. Mhm.
It's because they have to even it out, see, you know, so that's probably why we're always constantly doing this on routine, but I agree, we have not received any concerning data thus far. So.
I mean, the real worry though, what happens as fields age and the rubber degrades. So you really want to be testing the older stuff. If they said, you know, hey, we're going to be replacing the entire, you know, rubber content of this every 3 or 4 years, and we have data for 3 or 4 years, I'd be very comfortable saying we don't need to do further testing. But if they're not doing that and they're just adding, then, you know, some of the rubber that's there now is a decade old. That's the stuff that we have to worry about, not the new stuff.
Didn't they replace all this? Wasn't it the whole reason we had the turf company come and all of that, right? Where we talked about, I mean, they did just replace these fields a few years ago. So I don't think anything's 10 years old, right? I mean, am I missing something?
I don't believe anything is 10 years old.
Okay.
Yeah. I mean, if there's nothing that's that old, then, you know, we can defer testing until a point where it does get to be old, right? We have to pick what that is. That's when we should begin testing. We don't necessarily need to test when the fields are young.
Maybe Tim and Tara, you can kind of think about what might make sense, given, you know, if you look back at when things were fully replaced, et cetera, what maybe the right interval might be.
We
Thanks.
can do that.
Okay, and then the other item.
Sure. As the board is aware, because Tara shared it with all of you, we received received by email a letter from a town meeting member, which I can share screen on, outlining the neighbors' concerns about the ongoing litigation between the town, specifically the planning board, and Needham Enterprises, which is the group that has proposed to build a daycare at 1688 Central Avenue. There is ongoing litigation, so Tara quite appropriately talked to town council and asked what we sort of could say, should say, to not basically increase any of the time that the public health division staff has to speak to lawyers. And they did give us that text. Town council Chris Heath gave us that text. We did provide it to the town meeting member, and we provided a copy to the board, which essentially amounts to a nicer and slightly longer version of we have no comment while there's ongoing litigation, is sort of, I guess, how I'd characterize it. We do have members of the public amongst the attendees. So I don't know if the Board of Health wants to comment either on the letter or the response that we got from town council, which strongly advises us not to basically be involved while there's pending litigation until the litigation resolves itself. Or if the board wishes, or the chair wishes, we can recognize the attendees if they want to make a statement. I would suggest, as is the board's custom when there's a public comment, which is rarely, but the board generally takes a statement from the public, but does not necessarily respond to the statement. They just sort of take the statement, hear it, and take it under advisement. So would any of the board members either like to talk about the letter we received or town council's response, or would you like to open up for the public to make a comment?
Well, I think one question that I have about this, I mean, I do want to hear the comments, but, you know, we could talk with council, but should we be filing it, or would it be appropriate for us to file an amicus brief? If this is an issue that would have import for our jurisdiction, depending on how it's decided, I think that might influence the court. I don't know. But we may have some information that we should be imparting as part of an amicus brief. So I'm wondering if that might be something we consider.
Sure. I guess my initial thought is we have no solid information that there is environmental contamination at the site. We have anecdotal reports. We don't have soil testing results, and that's one of the challenges, right? The board was interested in having soil testing results or wanted to see soil testing results, but it's privately owned.
Correct. So the issue here, though, is, I don't know what the possible outcomes from the court decision would be. But if the possible outcome would be to say, go forth and you don't need to have any environmental testing, I think we would take exception to that.
Ed, you got a hand up?
Yes, I think we should follow town council's advice at this point. And not make a statement to the court. I did have a question. Why is this case before the land court? Is that a land court deed property or something?
I don't know the legalities. I think they're challenging, I believe, the applicant Needham Enterprises is challenging the planning board's authority to impose conditions. State law is, and I'm definitely not a lawyer, state law is pretty clear under the Dover Amendment that this is my layman's understanding, you can't put restrictions around the siting of an educational institution. And the planning board did against the advice of town council. And so that, I believe, is the crux of, I guess, the lawsuit.
If it ultimately came down to it after a court decision comes down and so on, it would be within our purview and within our legal right to simply require them to do the testing anyway, right?
I'm not entirely sure. Given that it's private property, I don't know that the board, without compelling evidence to back up without documentation that there has been environmental contamination, I don't know that the board would survive a legal challenge if it ordered testing on private property without evidence documenting that there is contamination. It's a little bit of a catch-22 because the reason for testing would be to determine if there is contamination.
Okay.
Private property, they're opening it as the intent is to open this as a service to the public, right?
Yeah, to open as a daycare. Yep.
Yeah. So if they're opening a service to the public, we have an obligation to protect the public. I don't care if it's private or private land or not. We do that all the time. That's why we have food inspections. They're serving the public.
We have authority to require conditions because we're granting a permit to serve food. The land use is different. And I'm not a lawyer, so I just know that it gets complicated. I'm not saying the board,
but we do
want to clarify.
Yeah, but we do have to permit daycares.
I don't
Not
think
in
so.
the state does.
Yeah, we don't permit daycares, the state does.
Is that away in the late 2000s, Tiffany, or early 2010s?
Yeah, it was probably a good 10, 12 years ago.
Rob, I know you had your hand up.
So if my memory is correct, what we had recommended to the planning board was that an independent assessment of that land be made. And that that was our recommendation rather than that we were recommending that quote unquote testing be done on the soil. Am I right on that?
Yeah, we said hire an LSP to look over the LSP, I guess.
Yeah.
That's what we talked about, we're not sampling. And then, yeah. And also, yeah, I think, well, I'm not going to get into the details. It just doesn't seem appropriate to comment on a legal case right now.
Right. I mean, I agree that I think the legal case has to play out, and then, once that is done, then we can weigh in on what we feel is appropriate for next steps.
And I think, understanding the level of evidence, as Tim has pointed out, is something very important. So, Tim, I think if this is a good time, I think we can at least take the public comments. And then, we can have further discussion after we hear more about what's happening on the legal side.
Sure, absolutely. I do see a hand raised. If the board is okay, I will allow the resident to whatever I do. Promote to panelist. There we go. Joe, we're gonna be promoting you to panelist. Hi, Joe.
Hi, good morning. Thank you for opening the call for comments. I'm the one who wrote the letter. I'm a town meeting member and submitted the letter, and I did get the response that I know was on the advice of town council. So first, I just want to thank the board for looking at the letter, and I appreciate your interest in this property and in the public health for it. Primarily, I just wanted the board to be aware, as you correctly stated, as the planning board was looking at the conditions, they did defer to this board on how to treat the potential environmental contamination. And they took upon your recommendation to include as a condition hiring an independent LSP to evaluate the property. Part of my letter was just to inform the board that during the lawsuit and motions that both sides have made, apologies for that, both sides have made to the court, during those motions, the planning board has removed that condition to have an independent LSP. They are no longer requiring that from Needham Enterprises. So whereas we left this last time, they were incorporating a recommendation and they've since backed off of that. So I wanted the board to be aware of that. And I do hope that in the future, once the lawsuit is resolved, that you would still consider the public safety, given that it's going to be a daycare center that the public will be using, to reevaluate your initial recommendation and see if it's still warranted. Thank you for your consideration.
Thank you for joining the meeting and providing comment. Appreciate it.
Thank you, Joe.
Thank you.
I will mention to the board, and Joe, I'm going to move you back to an attendee now. And I don't know how litigation has changed it. The applicant initially indicated a willingness to do two things: submit to an independent assessment and pay for an independent assessment. I think the town, we would want to be clear that if that was permitted following, if the applicant still said, okay, we've settled the lawsuit with whatever the outcome is, and we're still willing to allow testing without the board necessarily having to impose it, and that's a discussion we could have. Hopefully that would still be on the table. We did conduct, before litigation actually commenced, a formal competitive request for quotes. We sent it to 25 LSPs in the Metro West area, and none of them were willing to touch it. We tried small sort of one-person shops where possible, just given that many times if you're talking about a firm, they often work with construction companies, so it's harder to avoid conflicts of interest or potential conflicts of interest. We started revising it actually with some input from Kathleen and some of her colleagues to make it hopefully something more likely for people to bid on. And we weren't able to send it out before the litigation commenced. But if that is resolved, and if either the applicant determines to allow a review or the board decides one is warranted and decides it has the legal authority to impose it, we can sort of restart that process fairly swiftly. The challenge still is finding someone who wants to do the work, but hopefully we could do it. Madam Chair, I did want to, if it's okay, pivot to our last item. We have a colleague and a consultant who's helping us with our strategic planning, and I wanted to give him about a half an hour to update the board on sort of the start of that work, if that's
Yep,
okay.
absolutely. And Jim, just, if you can keep us updated as the legal piece plays out, that would be great. And I didn't give you 30 minutes, but we have 23, so hopefully that'll do it.
Sure.
23 is perfect, and thanks everyone for the warm invite. I'll just briefly share. So my name is Brian Murphy Eustace, and I support BME Strategies as our executive director. And if I go way back, I'll share, the first time I started working in local public health was in the town of Needham. I think it was in 2004. And I believe, Ed, you were on the board of the first Board of Health meeting I actually attended, but I might be wrong about that. I'm not sure if you joined a couple of years later, but it's great to, It's great to get to be back and seeing you all. My colleague Karen here is joining. And my hope today is just to share really the excitement that we feel to join and support Needham, the health department, in their sort of next strategic planning process. So in sort of envisioning the next 5 years of their sort of goals and objectives. What I thought I could do potentially is just share a few slides and kind of give a brief overview of the process and kind of where we are in that. One, for your awareness, but two, as a humble expectation and hope that we can engage with you all in helping to form and shape that strategic plan. I think your knowledge and experience within Needham is critical to the success of sort of the envisioning of the next strategic plan. And while a lot of the work in the process is kind of working closely with the team at the Needham Health Department, we also just want to make sure that key folks like you all are really incorporated in the voices heard throughout this plan. So I share that to say this is not the only time we'll get to talk about it. So 23 minutes is perfect for an overview. Maybe I'll just quickly share my screen and see if that might take us through it a little bit better. Let's see. Can everyone share my screen here? And I'll drag it out a little bit so you don't see all the sidebar stuff. Oh, sorry. Let's see. So about a few weeks ago, we kicked off the 5-year strategic planning process. And typically these processes can take a varying amount of time, but we sort of anticipate around a 6-month process, enough to really get into the details of things, but not too long that people burn out from the strategic planning. The intent of, and the folks working with the Needham Health Department are folks from my team at BME, which is a firm that just specializes in supporting local public health in a number of different strategy and program initiatives. And we've been doing that for the last 20 years, starting in Needham, as I mentioned. And I've also brought on some colleagues from Copper Strategic who I've worked with on past strategic plans that I think have a really nice understanding of strategy within the public sector space. We sort of, as a broad overview on the process, we could sort of designed it within 3 distinct phases. The first stage in the kind of planning and preparation, I kind of like to describe as sort of a look back in terms of what was the past strategic plans, what were the past goals and objectives, how successful were we, how did we monitor and measure and evaluate the way in which change was being made that was sought at the time that was planned for. And as well as sort of a look outward where we conduct key informant interviews and conversations with key organizations and individuals that impact the work that Needham Health Department does on a day-by-day basis. And then we sort of start to take a look forward at that point, starting with phase 2, where we start to really dive down into, and sorry, phase 1 also includes some work that we've already done in the first session around like missioning and visioning and values. Is the mission and vision of the Needham Health Department still relevant, not just today, but will it hold true for the work that they intend to do over the next 5 years, as well as the values, are those articulating, and values change and shape. And so it's important to revisit those in any new process. And then phase 2, in terms of looking forward, is starting to do some of the dive deep in the goals and objectives and timelines, as well as we like to look at a 5-year horizon, but knowing, as COVID recently taught us how fast things can change, just being really clear about kind of what is within the 1-year operational kind of working plan to drive forward that immediate change. And then lastly, spending some time to really build out the plan that we could then graphically designed to be somewhat of an external facing document that could be shared with partners and really speak to the vision and the goals of the Needham Health Department. So that's a little bit about the timeline and process. One thing that I think the board may be aware of probably well, but in case not, I'd be remiss to not mention is just, Needham is in the midst of the public health accreditation process where there's a national public health accreditation board that has set a series of standards and measures to become an accredited health department that has value for all sorts of reasons that I won't get into, but it's exciting that Needham's going through that process, and it's a really arduous and robust process, but I think it's well worth it. And part of the requirement for accreditation is to have a strategic plan. And so one of the things we'll be paying attention to, because we're familiar with that process, is just ensuring that key components that are required within the FAB accreditation process are also captured and achieved during this process, so that the 5-year strategy, what I love working with Tim is I asked him, so how are you approaching this? And he's like, we want an amazing strategic plan to be all aligned on what we're doing. And yeah, if it can also work for FAB, great. But the goal is an amazing strategic plan that we all know what we're doing. So I think we're very much taking in that thread is not losing sight of FAB, but that's certainly just a kind of a side part of it, if that makes sense. And then, so we did spend a little time talking through mission and vision. And then, so the next stages is we are preparing a research brief that will kind of outline who the key stakeholders are that we want to talk to. We're building out the timeline and work plan in a way that we can understand which are the touch points. My goal and hope would be that there would be a moment in a few months from now where we would get to come back to you all and convene this group and start to look at an early draft of what some goals and priorities could be to get your review and insight. And that's only more from a perspective that people tend to react a lot better to a first draft than a really rough first draft than a blank page, but happy to start earlier with a bit of brainstorming as well if that's of value. But I think typically in our process, that's how we've done that, is sort of we formed a committee within the Needham Health Department of the key staff that are informing this process. And then from there, we'll develop first drafts for review for other stakeholders like yourselves. Yeah, so that's kind of where we're at now as a high level overview. Maybe I could pause for any questions or thoughts. Happy to dive into any of the pieces a little bit further, because each one I kind of breezed over, had lots of information that we could dive into, but just want to make sure there's time for questions about this.
So I had a couple of questions to kick us off. One is, I was looking at the minutes from the meeting that you all had, and I did want to get clarity around sort of this discussion about Board of Health goals compared to the department goals. And yeah, so I just wanted clarity, because in my mind, I was thinking they really should be aligned and almost one and the same, except for that oversight function, obviously, that has to be over the top. But I just was curious how you think about that.
Yeah, I can kick off and others can jump in if they have a different perspective. But what I would say is that my feeling from that conversation that I came away from is that there was broad agreement that not just alignment, but sort of combination of having one set of goals would be the desired outcome, but that just a recognition that there are certain things that Board of Health members either would want to do or frankly sometimes might have to do in their function that is somewhat tangential to the health department, whether it is about certain core responsibilities that you have. And so it's thinking about the right way to allow for one set of goals between the Board of Health and the health department, but maybe distinguishing those things that are related to one or not the other in a more significant way. And I'm not sure I have I say that ambiguously because I haven't figured out exactly how to make sure that that's present. And I want to actually get a sense to see what are the breakoffs where you all as elected board officials have a different responsibility from oversight or other things, or communication or involvement with the broader government that I'd want to know before we kind of see if we do have to separate them. But I agree. I think everybody felt like, let's have it be one thing if it can be. Is that fair to say?
Yeah, I think, it's probably an oversimplification, but I view it as sort of the board's goals are a little bit high level and the public health division's goals are maybe a little bit more concrete. So, you know, the Board of Health goal could be, you know, an active, engaged, well-resourced public health department. And, you know, that could trickle down to the public health division level. And it's, you know, Tim needs to advocate for funding for X, Y, and Z, that type of thing. So, you know, you say well-resourced, and I say that means we need to have an epidemiological function. We need to have enough per diem nurses and part-time inspectors to supplement our full-time staff or something, you know, and you're maybe not down in the weeds like that, but the division goal and my goal is based on the overarching goal that you've set is sort of how I think of it.
Yeah, and I mean, I think that, you know, for strategic plans that I've seen, I mean, you'll have your high level strategies, and then obviously then you have your tactics underneath, and then you have your measures of the success of those tactics, et cetera. So I think the strategies is certainly where the Board of Health should be at. And it'd be great if we can think about, you know, thinking about board level dashboards. What are the rolled up measures that are going to be important for the board to be reviewing on a, you know, quarterly or whatever the right interval basis is, would be a good way to just make sure that we have line of sight, but are not in the weeds necessarily.
I think that's a really great point, because one of the required outcomes is a level of like a monitoring and evaluation plan for how we will measure success against the goals and objectives in the strategic plan. And typically that requirement is for the health department. But I think that's a wonderful flag to think like, well, the board has responsibility to monitor and measure the success. So why don't we make sure that either it's one dashboard or the dashboard speaks to the way that you would want to monitor it at a different level. And you're right, we fully expect that the plan would flow exactly as you said, that you'd have sort of the high level goals and strategies, and then you'd have sort of the sub objectives and activities that would ensure that that's successful. So I think it does align nicely.
Other comments or questions? Well, we certainly are happy to get pulled in at the right moments, you know, based on, I agree, sometimes it's better to respond to something as opposed to that one stage, but, you know, we would, I think we need to be part of the process. So we'll turn to you on the right moments to pull us in.
Great. Yeah, we'll be in contact and can share the full outline in which meetings we're hoping early to get it on maybe your agenda. If we can piggyback an existing meeting, if that's most efficient, or however you'd like to handle it. Yeah, and just where we are in the process, we had one initial meeting where we formed the committee and kind of made sure everybody's on the same page and started to peek at the mission and vision and things like that. But we're just kicking it off, so this is a great time to kind of share it with you all next.
All right. Tim, over to you if you have any final topics or comments you want to make.
No, I think we're excited. I think, you know, the entire division has been working on accreditation, but most especially Lynn and Cindy. And we're now at sort of a point where we need to make progress quickly on multiple fronts. So we are bringing in contractors and consultants we've worked with in the past, and we've worked with Brian and Karen and their colleagues quite a bit. So we're excited that we're going to have, we think, fairly rapid progress getting, you know, a chip in place, doing a performance management system, and trying to sort of formalize some of the things that we have done informally. We've really made it a goal over the last couple of years to really make things standardized, to have protocols, to have standard operating procedures for almost everything. And hopefully that'll be the culmination. And, you know, come the fall, we will formally submit our materials, I forget the exact language, Lynn and Cindy could tell me, but submit our readiness assessment, and then have, I think, 6 to 12 months to submit all the documentation. But we're looking forward to it.
Great. And, you know, not that I'm looking for any more work, but I will make the offer. I've done quite a bit of strategic planning, especially for boards, but also for organizations. So happy to react to anything offline as well, if that can be helpful. And I shouldn't have opened my mouth, I know.
Yes, you definitely shouldn't have. That is graciously immediately accepted. I would love to have some of your help. That's on offer.
All right. Well, so on the agenda, we do have listed the next couple of meetings for the Board of Health, Friday, September 8th and Friday, October 13th, 9 to 11. And Tim, I'm sure you'll be double checking with folks on attendance as it gets closer. Any other topics or comments from members before we adjourn? can't believe we may actually end early. I shouldn't even say that and jinx us, but anything else that anyone wants to bring up?
I actually do have one quick thing real fast if I could. We are in the process of putting together the biosafety committee like online application, and I just need to know how many community member postings we want to post for. Do we want 1 or 2? Because right now, the way it's looking, it looks like we have 1 board member, we have 2 employees, because we'll have Cy and then Julie. So do we want 2 more? If we only do 1, then it makes a 4-person committee. Or do you want another board member and 1 employee or 1 resident, like per person?
I'm thinking 1 board member, 2 community. What do people think? Just to make a odd number, but I mean, 5 people may feel like a big committee, but I know we had some interested folks or people with good backgrounds that we could probably pull in.
Yeah, I think we definitely need an odd number on that. And I don't think it would hurt to have 2 people from the community on that.
I don't know if we've decided who the board member will be, but I think Tiffany, that at least gets you started in terms of 2 community postings.
Yeah, that'd be great. Thank you very much.
Also, I just wanted to say something too. Going through the accreditation process has been one of my long-term goals for the board for a long time. I think I started pushing that 7 or 8 years ago. And I'm really, really pleased with how well it's progressing. I think everybody's done a lot of terrific work, and I know it's a hard process. Thank you.
A good team, very good team.
All right. Do I have a motion to adjourn?
So I'll move that. Okay.
I'll second that.
Okay, let's go ahead and do our vote. Rob,
Yes.
Ed,
Yes.
Stephen,
Yes.
Kathleen,
Yes.
and Tejal, yes. Okay, we are adjourned, and thank you everyone for comments and presentations.
Have a good rest of the summer.
Yeah, you too. Thanks.
Go well. Yep, bye.